Emotion regulation in borderline personality disorder, BPD, role of mindfulness in managing BPD. One of the most challenging aspects of borderline personality disorder, BPD, is the difficulty in managing intense and rapidly shifting emotions. Individuals with BPD often experience extreme emotional reactions that can feel overwhelming, and they may struggle with impulsivity, emotional instability, and relationship difficulties. Mindfulness, however, has emerged as one of the most effective tools in managing these emotional challenges. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the role of mindfulness in emotion regulation, how it helps individuals with BPD manage their emotions, and how mindfulness practices can lead to greater emotional stability and self-awareness. What is mindfulness? Mindfulness is the practice of focusing attention on the present moment with an attitude of acceptance and non-judgment. This practice involves being aware of your thoughts, feelings, bodily sensations, and the surrounding environment without trying to change them or judge them as good or bad. The goal is to observe without becoming overwhelmed or reacting impulsively. For individuals with borderline personality disorder, BPD, mindfulness provides an opportunity to pause before reacting to intense emotions, offering a sense of control over their emotional responses. It helps individuals recognize when they are experiencing heightened emotions and respond in a calm, rational, and adaptive manner, rather than reacting impulsively or destructively. How mindfulness helps in emotion regulation for BPD. Mindfulness plays a critical role in emotion regulation for individuals with BPD by providing them with the tools to better understand and manage their emotions. Here's how mindfulness can help with emotion regulation. 1. Increased awareness of emotions. In BPD, individuals often experience emotions that feel intense and uncontrollable. Mindfulness encourages individuals to become more aware of their emotional experiences as they arise. By practicing mindfulness, individuals can begin to notice their emotions early on and become more attuned to how their emotions influence thoughts and behaviors. Emotional awareness. Mindfulness helps individuals with BPD recognize emotions as they emerge, which allows them to address emotional dysregulation before it escalates. This early recognition is critical in reducing the intensity of emotions and preventing impulsive actions. 2. Non-judgmental observation. A core principle of mindfulness is the practice of observing emotions without judgment. Individuals with BPD often experience intense emotions that they may label as bad or wrong. This can lead to feelings of shame or guilt, which in turn can exacerbate emotional instability. Mindfulness encourages individuals to accept their emotions as they are, without trying to suppress or change them. Acceptance of emotions. Mindfulness teaches individuals to acknowledge that all emotions are valid and part of the human experience. This acceptance reduces the shame or guilt that can intensify emotional distress, allowing individuals to experience their emotions without becoming overwhelmed by them. Self-compassion. Mindfulness fosters self-compassion, helping individuals with BPD treat themselves kindly when experiencing difficult emotions rather than criticizing or punishing themselves. 3. Mindful awareness of triggers. In BPD, emotions are often triggered by external events or interpersonal interactions. Mindfulness helps individuals become more aware of these emotional triggers and understand how their emotions are related to these triggers. With this awareness, individuals can learn to interrupt the automatic emotional response and make a more conscious choice in how to react. Breaking the cycle of emotional reactivity. When an emotional trigger occurs, mindfulness creates a pause between stimulus and reaction. This pause allows the individual to observe the situation without immediately acting on their emotions, giving them time to choose a more balanced and thoughtful response. Recognizing patterns. Mindfulness can also help individuals identify patterns in their emotional responses. For example, they may notice that certain types of interactions, for example, perceived criticism or abandonment, consistently lead to heightened emotional reactions. Recognizing these patterns can help them prepare for emotional responses in the future and respond more skillfully. 4. Mindfulness-based emotion regulation strategies. Mindfulness provides specific strategies to help individuals with BPD manage their emotions in healthier ways. Breath awareness. By focusing on breathing, individuals can calm their nervous system and reduce the physical symptoms of stress and anxiety. Deep breathing activates the parasympathetic nervous system, which promotes relaxation and emotional stability. Body scans. A body scan involves mentally scanning the body from head to toe and noticing physical sensations. This practice helps individuals become more attuned to their emotional state and bodily cues, making it easier to recognize when emotions are starting to intensify. Grounding exercises. Grounding techniques such as the 5-4-3-2-1 technique, identifying 5 things you can see, 4 things you can touch, etc., help individuals stay connected to the present moment, reducing dissociation or emotional overwhelm. 5. Improved impulse control. For individuals with BPD, impulsivity is often a significant problem. Intense emotions can trigger impulsive actions, such as self-harm, substance use, or reckless behaviors. Mindfulness can improve impulse control by helping individuals pause and reflect before acting on their emotions. Urge surfing. This mindfulness technique involves recognizing and observing the urge to engage in an impulsive behavior, such as self-harm, without acting on it. Individuals with BPD can learn that emotional urges, while intense, will pass with time. By practicing mindfulness, they can allow the urge to wash over them and dissipate without resorting to harmful behaviors. 6. Decreased emotional reactivity. Mindfulness helps individuals with BPD reduce emotional reactivity, allowing them to respond to difficult situations in a more balanced and grounded way. This is particularly useful in interpersonal relationships, where individuals with BPD may feel overwhelmed by feelings of rejection, abandonment, or anger. Response versus reaction. Through mindfulness, individuals learn to distinguish between reacting impulsively to their emotions and responding thoughtfully. This shift helps reduce the intensity of conflicts and improves emotional stability in relationships. Mindfulness and dialectical behavior therapy. DBT. Dialectical behavior therapy, DBT, developed by Marshall Linehan, incorporates mindfulness as one of its core components. DBT is particularly effective for individuals with borderline personality disorder, BPD, because it provides a structured approach to emotion regulation and interpersonal effectiveness while emphasizing mindfulness techniques to manage intense emotions. In DBT, individuals with BPD are taught mindfulness strategies to help them observe their emotions without judgment, describe their emotions in a neutral, non-reactive way, participate in activities without being distracted by overwhelming feelings, practice mindfulness of the present moment during everyday interactions. By integrating mindfulness into the therapeutic process, DBT helps individuals with BPD develop greater emotional control and build more stable, fulfilling relationships. The benefits of mindfulness for BPD. 1. Increased emotional stability. Mindfulness allows individuals with BPD to recognize and manage their emotions more effectively. This leads to improved emotional regulation and reduced emotional reactivity, which helps individuals maintain more balanced emotional states throughout the day. 2. Reduced impulsivity. Through mindfulness practices, individuals with BPD can become more aware of emotional triggers and learn to pause before reacting. This reduces the likelihood of impulsive actions, such as self-harm, reckless behaviors, or relationship-damaging outbursts. 3. Improved relationships. Mindfulness helps individuals with BPD become more aware of their emotional responses in relationships, allowing them to communicate more effectively and respond to interpersonal conflicts in a calm and thoughtful manner. This leads to more stable and healthy relationships. 4. Enhanced self-compassion. Mindfulness teaches individuals to accept their emotions without judgment and develop self-compassion. This reduces the negative self-talk and shame that often accompanies emotional dysregulation in BPD, helping individuals feel more accepting of themselves. 5. Increased self-awareness. Mindfulness practices help individuals with BPD develop a deeper awareness of their emotions, thoughts, and behaviors. This awareness is the first step toward change and improvement, as it allows individuals to understand why they feel a certain way and how their emotions influence their actions. Conclusion. Mindfulness is a powerful tool for emotion regulation in borderline personality disorder, BPD. By helping individuals become more aware of their emotions and respond to them without judgment, mindfulness promotes emotional stability, impulse control, and improved relationships. Through mindfulness-based practices such as breath awareness, body scans, and grounding exercises, individuals with BPD can reduce emotional reactivity and cultivate a greater sense of self-awareness and self-compassion. Incorporating mindfulness into treatment, especially in therapies like dialectical behavior therapy, DBT helps individuals with BPD learn to manage their emotions more effectively, leading to a more stable, fulfilling life. In future episodes, we will continue to explore additional strategies for emotion regulation and mindfulness practices to further help individuals with BPD on their journey to emotional healing. Stay tuned for more insights into borderline personality disorder and its management.